Welcome, everyone. Good morning. I'm Fulbright Garcia Robles, Mexico Chair Studies at USC, and it is a great pleasure for me to welcome you to this panel that is aiming at identifying the lessons from the impact of COVID in Mexico and beyond in order to build a research agenda for a more just and resilient future. The starting premise of our seminar is that when reality changes, we must address it collectively with better evidence, profound questions, and rigorous methods to inform policy, to tackle emerging issues, and to address structural social inequities and sources of vulnerability. I am very excited to welcome here a group of well-known experts from leading institutions in Mexico who have been doing pioneering work, gathering empirical evidence, and systematically and rigorously addressing some of the core lessons that are emerging from COVID in Mexico and beyond. And without more, I will only say that we have Graciela Teruel from Universidad Iberoamericana. She's the director of the Center for Sustainable Development and Social Equity. Héctor Villarreal is joining us from the TEC de Monterrey, Instituto de Estudios Superiores, Tecnológico de Estudios Superiores de Monterrey. Raymundo Campos from the Center of Economic Studies at el Colegio de México. Emma Aguila from USC and the Schaeffer Center, and Gary Painter, who is also at USC, and he's the director of the Center for Social Innovation, who thankfully accepted to co-host this meeting with me to promote this discussion for a forward-looking research agenda to inform social policy in Mexico beyond borders. We strongly believe that with better evidence and with international collaboration, a science with open borders, we can collectively tackle these pressing issues, and this is one first step in this direction. Without further comments, I will please ask Professor Graciela Teruel to start. Thank you so much.
Thank you very much, Claudia, for the invitation to be here. I'll be sharing a presentation. This morning, I'll be talking about a project that we started conducting as the pandemic hit in Mexico. It's called the COVID-19, and it's meant to measure the effects of COVID on the well-being of Mexican households. So in March last year, the National Bureau of Statistics announced that it was not going to be possible to collect information on employment. And so at Equide, we decided to conduct a telephone survey to measure basically 4 indicators: employment, income, and we decided to add mental health and food security. And we decided to do this every month at the beginning, then we changed to every 2 months, and now we're doing it every 4 months. The COVID-19 comprises 10 rounds of data: April, May, June, July, August, October, and December last year, and this year, March, May, and October, as well as 3 rounds of 2 states that were hit the hardest, which is Mexico City, and 1 for the state of Mexico. And we just recently added a longitudinal survey following the same individuals we interviewed last year, a year later. So I'll be showing some of these results. Let me start with just showing very basic information on the percentage of Mexican households who reported that at least one of its members had COVID or one of its symptoms. And it started obviously very low in May last year, and it started to grow over time, reaching in this October 21 almost 34%. And this is a slide that I like very much because it shows, even though the government policy is to provide free medical services in Mexico, this is how much out-of-pocket expenditure the population of Mexico had to disperse on medical attention, consultations, oxygen tanks, medicine, etc. So look at the first panel, the one that is in the upper part. It says that 40% of individuals in Mexican households who experience COVID spent more than $500 in medicines. This is very high, especially if you look at what the poverty line is. This is more like 7 times the poverty line. And when you distribute this in socioeconomic levels, the numbers are basically the same. So which means that the poor households are really being hit by this kind of expenditures. This is what happened in general to employment. And we have a very, what we call an extended employment rate, which considers not only those that are looking for a job, but those who were furloughed or who couldn't work or who couldn't search for a job due to the lockdown. So obviously the highest rate was in May. Last year, it skyrocketed. More than 8.5 million people were unemployed with this definition. But it's been recovering over time. And if we look at what happened to these rates as October 21, they're basically recovered. So if we looked only on unemployment, we would say Mexico is doing fine. However, what has happened to income? And this is the percentage of households reporting that household income was lower than before the pandemic exploded. And in May, we had more like 70%, 69% of the population saying that their income was lower than before the pandemic. And basically, it didn't change last year very much. And it started to recover actually this year. Look at May and October this year. It went to 48 and 56%. But the dotted line here, the orange one, it's showing a reduction of more than 50%. And this was very high. One of every 3 Mexicans actually reported a reduction of more than 50%. And it's starting to recover as of May and October this year. It's only 1 out of 5. And this is when we break it down by socioeconomic levels. And we have the lowest socioeconomic group at the top. So obviously they have been hit the hardest. And the green one is the high socioeconomic group. So this is using the panel data and just following people over time, a year after they were interviewed. And this is the same income indicator that I was showing just before. And this is how they transitioned a year later. So we have 65% saying that they have a lower income that they had before the pandemic. And in 2021, it's only 44%. So a high percentage of them move to a higher income, almost 16 percentage points, whereas 5% only moved to the same income. So this is showing what has happened to some income mobility after a year of pandemic. And this is, what has happened with government support. So basically, government support didn't change to assist Mexicans to cope. If you look at this, it basically started 29% in June, but it's been almost around the 40%. So this means that there was really, there's like 6 out of 10 Mexicans not receiving any support at all. And this hasn't changed due to the pandemic, not last year, not this year. So how are these individuals, Mexicans, coping then with the crisis? So I'm just going to show 3 indicators here. The first one has to do with the percentage of households reporting borrowing money. So it started in May, 34%, and it's gone up all the way to 52%. So 1 out of every 2 Mexicans are borrowing money to cope with the crisis. Look at the orange bars right here. The percentage of households falling behind in payments started in 34%, went all the way up to 48%, and now it's in 44%. The percentage of households pawning or selling assets started in 16%, and it's going way up to 27%. So Mexican households are endangering their medium-term wealth to cope with the crisis. And this is the last indicator I'm going to be talking about, which is anxiety. And this is one of the indicators we didn't know at the beginning when we started collecting it that it was going to be such a big issue, but it has been. It started all the way to 32% in April, and it's basically maintained more or less the same level throughout last year, and it's starting to recover in May and October this year to 24%. When we break it up by a low socioeconomic status and high socioeconomic status, those that are poor are being hit the hardest. And one of the bad news is that there are no services provided by the government to cope with these kinds of problems. So Basically, just to conclude, the data is being made public, so we invite students to use it. The pandemic has hit Mexican households, although the highest toll has been paid by those in the lowest SES status. The gaps that existed between the rich and the poor have been widened, which is worrisome. Employment levels have already recovered, but not income levels, and long-term wealth is being put at risk, especially since the population has not received any specific aid to cope with the crisis. Social interventions did not really change at all, and mental health has been greatly affected without proper or enough services to offer those in need. So just, I wanna thank Campos and UNICEF for the support to conduct this survey. Thank you very much.
Thank you so much, Dr. Teruel, for this path-breaking information that will not only help us understand what's happening in the short term, but also anticipate long-term effects that need to be tackled by a different set of policies and priorities in terms of public response. Raymundo Campos from el Colegio de México, your turn.
Thank you for the invitation. I'm very happy to be here. So let me talk about the future research that we need to be doing and the questions that I think are the most relevant. Of course, I am a labor economist, so most of my questions are related to my my field of study. But one key question, I think, it's the consequences of long COVID. I mean, we know that COVID may have long-term consequences. For example, fatigue, chest pain, brain fog, and others. Of course, this has consequences for public health, but there are other important consequences. And one of them is, for example, employment. So is this going to be a source of discrimination in the labor market? Are employers going to screen for these symptoms in the future, or are they currently doing? I did an audit study with Eva Arceo and Junuen Badillo, where hopefully we'll have a working paper soon. But what we do is we basically vary information on the CV on whether the person has had COVID in the past or not. And what we are seeing with the data that we gathered was that, for example, for men, it was harmful to say that you had COVID at the beginning of the pandemic around in September, but later on in November, December of last year, these didn't have any consequence. So we don't know if this could affect now how is affecting having COVID or not. I think that's a relevant question. Another one is the consequences in terms of employment. So many surveys or in administrative records, you don't know if a person had COVID in the past. So we are gathering, again, with a team of researchers here in Mexico, we are gathering a database from IMSS. And IMSS, for example, is the public health institution in Mexico for formal sector workers. So there, with IMSS, we are gathering a database that has information on whether a worker had COVID in the past, and then IMSS has very good records. We can know the employment trajectory before COVID and after COVID. And so we are tracking these workers to see how, if you had COVID, how that affected your employment outcomes, basically. And of course, this can change how you value public health insurance, but also can have other consequences in terms of, for example, early retirement. What are the consequences for public pensions and the financing of these pensions? And I think one key aspect, and Graciela mentioned this in her presentation, is that I believe all surveys now need to include questions about COVID contagion, how the symptoms, if you had COVID in the past, if you have symptoms now. I think all surveys need to include that question. That's very important now. And then I think I have two other topics and then a final reflection on this. So one is education, schooling outcomes. I mean, COVID had important effects on attendance, learning, study times for children, especially for those in families with low socioeconomic status. This implies that social mobility is going to be more difficult in the future. But I think we need to understand not only the descriptive part on differential learning, but we really need to understand which policies are more appropriate to recover this lost time. So, for example, in Mexico or in the US, are municipalities doing things differently? Can we learn something from this? What is the role of different economic trajectories across municipalities? So is the recovery in some municipalities affecting the educational outcomes? So, for example, in Mexico, the northern border, the border that shares, the municipalities that share a border with the US are recovering more faster than other municipalities in Mexico. So is this, should we analyze that to study not only employment outcomes, but also educational outcomes? Finally, so Graciela showed results with the survey that they are doing at the Universidad Iberoamericana. The National Survey of Occupation by INEGI still shows us that female employment has not recovered yet. Is going to recover, but we don't know how rapid is going to be that. So this obviously Graciela showed that it has very serious consequences for income generating opportunities at the household level. This is very bad for gender equality overall, because if women, if women that were working before the pandemic and now are not working, of course, this has consequences in the time invested in caring activities, role models for children and for the youth. This has consequences for intergenerational mobility. I mean, we need to understand whether this phenomenon is similar to the Great Resignation that is happening in the US and other countries. I mean, women value this new situation, or are there structural barriers, clear structural barriers that affect the return of women to employment? And which of these structural barriers is more important? I think all this is relevant. And then one final reflection just to finish is, I mean, what is the role of the state in all here? I mean, one possibility is that the state intervenes with cash transfers. Another possibility is that the state intervenes with more state capacities. So in a country, in Mexico, with low tax revenue, there are very hard trade-offs. And my biggest worry here with the pandemic is that Mexicans say at the end is like, okay, look, we did okay, we did good. We don't need the government. We don't need the state. We should aim for lower taxes and even lower tax revenue capacities. And if we go in that direction, I think it's going to be very bad for the country, for the opportunities we have to fight inequality and to promote social mobility. And I think that's a key question that we need to ask ourselves, and we need to do research for this in the future. Okay, that's it. Thank you very much for the invitation.
Thank you so much, Dr. Campos, for bringing about the political economy perspective in this discussion. Now I would kindly ask my colleague, Gary Painter from the Center for Social Innovation, to comment.
Thank you, Claudia. And I also want to thank Graciela for presenting such clear evidence on what is happening in Mexico and what has happened over the last 18 months. I think that's really important as we really begin our discussion here. And I really appreciate Raymundo, who really laid out the research agenda. What do we need to learn about how these changes that brought on by the pandemic may affect people now and far into the future? One of the things that both of you brought up in your presentation to some extent is the role of the state. The role of the state in terms of addressing a crisis, and or the role of the state in terms of helping us move forward in a way that provides greater equity across populations, since there was clear disproportionality in terms of how COVID has impacted lower income populations and middle or higher income populations. For those of us who are in the audience who are from the US, you may not realize that both conditional cash transfers and unconditional cash transfers have been used in Mexico and Latin America for quite a long time to investigate impacts on the well-being of populations. Here in the US, the idea of basic income, universal basic income, freedom dividend, lots of different names is fairly new. And until the kind of interventions around COVID-19 here in the US, we haven't had such interventions at scale. We've talked about them in context of stimulus package, but it really isn't a stimulus package. It really is a way of delivering guaranteed basic income, of delivering cash transfers and so forth. And I wondered if both Graciela and Raymundo would be able to share a little bit about what you see as the possibility of the role of either conditional or unconditional cash transfers to help Mexican residents recover from COVID-19.
Do you want me to start, Raymundo? Okay, well, actually, this new government changed the way social interventions took place in Mexico, or take place in Mexico. We did have conditional cash transfers for the last 3 governments. Prospera, everybody knows about Progresa, Prospera, Oportunidades. This government closed that program and closed other programs. And the idea that this government has had is to focus more on the poor population. So they had, at the beginning of its government, 17 new programs, some of which have already closed, but they were targeted to the poor mainly. And those programs didn't really change with the pandemic, even though it was needed. There were some subpopulations that were being hit very hardly, those in the unemployed sector, for example. And they really haven't done any kind of intervention or special intervention to help them. So I don't think there's conditional cash transfers. I don't think there's going to be any conditional cash transfers anymore, because this government doesn't really doesn't like them. I mean, I don't know, Raymundo, if you want to compliment.
Yes, thank you. Well, I mean, if you ask me, do you want this? Of course, I mean, I want conditional cash transfers, and I want better infrastructure. The problem is that Mexico is a country with low capacities, state capacities, and low tax revenue. So what is feasible? I would like to have a more deep discussion on the infrastructure part. So, for example, 2 examples, what is happening in Mexico. So now that the kids are returning to schools, what the schools did was, okay, in public schools, this is in public schools, parents, you need to come and paint the school and clean the school and bring the resources. So the schools and the educational system is public, but we're privatizing because there are no public funds to attend these demands. In the health sector is the same. So you have now, people know you need to buy your medicine. If we need some instruments to treat you, you need to buy those instruments. So we are privatizing in some sense. And I think we need to look at both. but especially the infrastructure part is very important. And I come back again to my final point and what you mentioned, Gary, in your presentation is my worry is that okay, the people are seeing this, are seeing that the government is asking for expenses in education, in health, and didn't have any cash transfers. Then the people can be asking themselves, well, I mean, we're doing all this. Why do we need the government? So I think after the pandemic, what we're seeing and what we need to study is that the people probably are going to say, we want lower taxes because we lived through this pandemic without the state, without the government, and we know that we can live without the support of the government. So I think that's a key question, and we need to think about that. Okay, so I'll stop there.
Yeah, thank you, Raymundo. And I mean, I think it's an interesting perspective given the data that Graciela presented. And what does it mean to live without the government? Because so many people were, at much lower levels of household income. And so, what does that even mean to live without government? You may be living, but you may have your well-being cut substantially. So that leads me to my maybe final question, as I know we have a wonderful panel coming right after me, and after our conversation. So I direct the Price Center for Social Innovation, and so it makes me think about, is there a specific problem, a complex problem in Mexico that you think that we either need social innovation to solve, new ways of addressing these social problems, or perhaps there needs to be private sector innovation. And Raymundo, as in your role as a labor economist, maybe I'll let you go first, and then Graciela can conclude. What do you think is more needed, and if you have something to private sector innovation, or do we need social innovation?
Yeah, that's a good question. I think more in terms of social innovations, and what I think is most needed right now is investment in the health sector, in the educational sector. We really need to convince society and the people that the government is there for a reason, that it has a function, that we need, if we want, Mexico is a high inequality country with many social problems, and the private sector may help in solving parts of the problem, but the problems are so big than we really need government intervention. Government intervention in the sense of better schools, more and better schools, better hospitals, better treatments. Without this, it's very hard to think about a country with more equality in terms of opportunities to its people. So, and for that, I really think that we need more taxes, progressive taxes. But my worry is that with this pandemic, I guess that we lost this opportunity in saying and signaling that the state and the government is necessary, and that we need more taxes to tackle these economic problems, big economic problems. So that would be my take.
Thank you, Raymundo. Graciela?
I completely agree with what Raymundo just said. I would just add that we need all kinds of innovation. Lately, this government has had a very tough policy on research, on technology, and I believe we're going backwards 40 years in terms of this. So we do need all kinds of support to promote innovation, both privately and socially. That's the only thing I would like to compliment.
Thank you. And now, Claudia, I think we are ready to move on to our next panelist.
Thank you so much, Gary. Well, I think in a way, both Dr. Campos and Dr. Teruel anticipated some of the intergenerational and budgetary constraint in which this discussion must be addressed. And this is the perfect entry point for the participation of Héctor Villarreal from Tec de Monterrey.
Many thanks, Claudia. I'm very grateful for this seminar and the opportunity to participate here. I will be very brief, but I would like to catch up on some of the points that Raymundo was making. Yes, indeed, we do have a big problem with our fiscal system, and during the pandemics, this was like especially noticeable. You can see that there was this dilemma in Mexico about if the government should put like more effort into doing policies. At the end of the day, and this was something surprising for many people, the government played a very conservative role. Even though we were like in this crisis and our GDP was just like falling in a very dramatic way, they say, no, we should be like very careful about our public finances, and they were really not accepting the possibility of doing a more aggressive fiscal policy. If you see any comparative table, it's amazing. Mexico was one of the most fiscally conservative countries in the world during this crisis. Now, at the end of the day, somehow they are changing this, but they don't like the idea. But they said, okay, we need to go to a small primary deficit that is income minus expenditures without considering debt service. We need to go to this small primary deficit during 2021. Maybe we'll do the same for 2022. But we have a lot of trouble here, Claudia, and something that is really limiting our capacity is that we have contingent liabilities. And especially, I want to talk about pensions. Raymundo was talking about this very weak fiscal system. Okay, for every participant in the seminar, let me tell you that Mexico is spending now in pensions more than 1/3 of its complete fiscal revenues. So what are we going to do? And this number is expected to grow quite a lot during the next 10 years. At the same time, Claudia, and we have the problem of, and this is not just Mexico, this is not just Mexico, this is all the Latin American region, and it's very good that Emma Aguila is chairing the panel. We have a very accelerated demographic transition. What happened in, for example, if you compare with Western Europe, it's happening in the Latin American region in about 1/3 of the time. It's very difficult for public policy to cope with this. Very, very, very difficult. So we need to talk about pensions. We need to talk about the health systems, because when you have a demographic transition, you also have an epidemiological transition. So this will be very expensive. And Graciela was saying something about this. Raymundo was saying something about this too. Maybe our health system is not prepared for this. And I would like to take in one point from Gary Painter. Is this going to be social innovation or private innovation? Maybe we need both. I mean, I don't see how we, Mexico, can cope with this. For example, with some low-cost insurance. If this is going to be social, if this is going to be private, maybe it's going to be a mixture. But we need to do something about that too. Now, regarding research and policies that can work for both US and Mexico, we need to talk about the economics of care. There's a very nice opportunity to integrate our economies. I believe that, at least for some time, Mexico can be a very interesting provider for the economics of care for American elder. Maybe after some years, we will need to balance a little bit more and see how our labor markets integrate and what kind of combined policies we can do. But this is a very interesting line of research. Now, very quickly, infrastructure. The problem that we have, and this is going to be like an intergenerational tension, is that we have low revenues on the one, low taxing revenues, but at the same time we need to spend in many pressing issues, and we need to invest. Otherwise, our economy will not grow. So the political economy issues surrounding this kind of decisions will not be that easy a lot. I'm very glad that Price is inviting us to this seminar. I hope that this will be the starting point for a research agenda, a combined research agenda. We are designing a new webpage that is trying to combine these efforts of the fiscal front, the demographic thing, and pensions, health systems, economics of care. I hope that you find it interesting and that we can do some work together about it. Thank you.
Thank you so much, Hector, for bringing the cost and the financial side of the policy debate in perspective. And this, you mentioned in your presentation, the opportunities for learning from long-term developments and demographic change, epidemiological change that has happened in other countries, and how that can provide the basis for learning and cross-fertilization, both in terms of research and policy. And Dr. Emma Aguila from USC and the Sheffer Center will share her knowledge on what's happening on the northern side of the border with respect to these vulnerabilities and sources of inequality. Thank you.
Thank you so much, and it's really a pleasure to be in this webinar. And thank you, Claudia, and thank you everyone for being here. So I'm going to talk about Mexicans in the U.S. So first, I'm going to give you some statistics about Mexicans. So Mexicans are the largest group of immigrants in the U.S. So Mexicans represent 24% of foreign-born residents. So this is equivalent to 10.9 million Mexicans in the U.S. 51% about 50% of Mexicans are undocumented. This is 5.6 million of Mexicans. A higher proportion of Mexican immigrants are at working age, so between 18 and 64 years old. There's also previous literature that has found that Mexican immigrants are negatively selected on skill. So that basically implies that lower skill workers have more incentives to migrate to the US than higher skill workers. So we observe actually that on average, Mexicans in the US have a much lower levels of educational attainment than US born. So less than, on average, than high school education. So in terms of previous research as well, in terms of the vulnerabilities and poverty, there's more research in general about Hispanic population. So I'm going to refer to that now, to the previous findings. And it's relevant to talk about Hispanics as well, because more than 50% are Mexican origin. So previous studies for Hispanics have found that Hispanics are more likely to be employed in small firms, in low-paying jobs, and also in occupations where they don't have access to employer retirement plans. Many of them work in the gig economy, so like freelance work or temporary work, as well as in the informal sector. So this also leads to like a lower lifetime earnings for Hispanics in comparison to non-Hispanic whites. And this affects for those that have access to receive Social Security benefits at retirement, they receive on average lower Social Security benefits than non-Hispanic white. So there's a cumulative difference over the life cycle, and we can see a large income and wealth gap between Hispanics and non-Hispanic whites. So also for Hispanics, it has been found that they are more at risk of financial insecurity in old age. The poverty rate, so for example, for Hispanics at older ages, is 17.7% in comparison to 6.6% for non-Hispanic whites. So there's also previous evidence that have analyzed the effects of the Great Recession between 2007 and 2009. This is just to, I'm going to talk about as well about the effects in terms of like the recent pandemic. So, but in terms of the Great Recession, it has been found that Hispanics and other minorities population were more affected during the recession, and they also, have lagged behind non-Hispanic whites to recover after the Great Recession. In terms of, the experience with COVID-19, according to the CDC, they have reported that Hispanics are at a higher risk, greater risk than other racial groups of having COVID-19. And this is in terms of hospitalizations and deaths. So partly it's explained because of their occupation that many of them have to work outside home. So in also recent surveys, 49% of Hispanic households have reported to be financially affected in 2020. So it's very likely that all these long-standing inequities for Hispanics in terms of the types of jobs, healthcare access, having a heavier caregiving burden, and health issues, most likely exacerbated during the pandemic. So in terms of research agenda, I would suggest we need to consider, for Hispanic population as well for other minority groups and low-income population, we need to have better data and more research about the work histories, right? Like work histories for workers in the gig economy, in the informal sector. We need to understand their labor benefits, their working conditions. As a previous panelist mentioned, we need to know whether they had COVID-19, follow these individuals, low-income population, to understand what are the health effects and what are the health effects from COVID-19 in their labor trajectories or in the labor market. And as we've all mentioned, there's a large heterogeneity in the outcomes for this low-income population. So we really need very good data and studies, not only quantitative, but also qualitative research, so that we can understand these diverse work pathways, right? And try to come up with policies that can help reduce poverty and inequality. And I would consider as well, we should think about like successful stories or successful programs that have been implemented in other countries. So like the Mexican case that has a very relevant conditional cash transfer program that had really strong effects on reducing different dimensions of poverty and inequality. So I would suggest that in the US, we should consider programs that have been successful, in other countries, and also, see how like other surveys and like the work that was presented in this panel, like how to understand this dynamic situation or this diverse population that may be adapting from working outside of home. How do they, if they lost their jobs, to understand how they transition or what are their transitions in and out the labor market. So, perhaps, consider, not only policies in Europe, but other developing countries, as I mentioned, to tackle poverty and inequality in the US.
Thank you, Emma and Hector. On the one hand, every information you have shared and the data suggests that we not only need to tackle well-known structural sources of inequality, poverty, and vulnerability, but also try to proactively respond to the changes and the new sources of vulnerability brought about by the pandemic, and at the same time, thinking in terms of policy, fiscal viability, and also the political economy that is going to help us build back better. Not only learn from this shock and be ready for other types of shocks to make societies resilient, but also rethinking on broader issues such as the role of the state, the real cost of coping mechanisms, whether they are private or social, the intergenerational implications of long COVID, but also short recovery or slow recovery for opportunities for social inclusion and development. And of course, this information and this data are sobering and worrisome. This is something that we have learned from many countries in the world. There are signs of for concern. But I also would like to think that crises are also an opportunity for learning and an opportunity for change. So I would like to ask you what you think are one or two aspects in which cross-border learning and thinking scientifically about social issues beyond borders can help us at this juncture. Some of the aspects of social exclusion and disadvantage among minorities in the US, unfortunately, are attributes and barriers that we are studying in the Latin American context and in Mexico for larger groups of the population. The barriers faced by minorities in the US are the barriers faced by majorities in Mexico and Latin America. And the potential use of the potential resource to social innovation, more active private sector participation, but also being able to produce and identify the type of information and data that can accompany people, markets, households over their life cycle, and therefore inform policy, are also something that has been mentioned during the seminar. I don't feel free to comment anyone from the panel. What are your thoughts on this? Where do we go from here?
I believe, Claudia, that digital public finance and all these new fintechs can provide a nice opportunity for collaboration between the two countries. We need to work more with the payment systems. We need to try to get advantages with all these new available data, and we can certainly do better public policy with that.
Yes, I agree with Hector's comment. I think, there's a lot to learn. And, I think, Graciela didn't, she presented her latest survey, but she can also, she's an example of following up as well individuals, from Mexico that migrate and return to Mexico. So there are a lot of, things that we could do actually in order to understand better the situation of Hispanics and particularly Mexicans in the U.S. with experience from Mexico, and as well, think about culturally competent policies, taking into account these the previous findings in Mexico that has larger samples, as you mentioned, and has very detailed surveys and a lot of innovations in terms of social policy and data collection.
There's in our audience was particularly interested in the role of the private sector and the role of the distinction between public and private innovation to tackle these emerging problems with a new set of policy or a different take on the social policies. Does anyone want to comment on that? Some people from our audience were struck by the fact that there was no more private innovation or private organization during the pandemic as a form of collective response to the crisis, given the fact that the Mexican government chose to stay the course in terms of social and fiscal policy despite the shock of the pandemic.
I can try to comment, Claudia. I think there was private efforts to help, especially the poor, but they were actually directed by either small ONGs or other private groups. So, I mean, there was, but it wasn't really widespread, and it wasn't really that big, but there was.
Do we still need a distinction between social and private innovation after COVID? I'm thinking in the sense that there is this international discussion regarding how this type of shock does not require incremental response, but transformative change. Going back to the big questions of the social contract, the role of the private and the social mechanisms of risk management and coping. And also, of course, the political economy behind that. We have two hypotheses here in the panel. One that suggests that maybe the distributive impact of COVID might produce a higher value and therefore willingness to pay for social services and social protection mechanisms that were not in place during this difficult time. Or at the same time, the other hypothesis that the fact that households and citizens had to cope on their own in the absence of a forceful, proactive social protection strategy actually reinforced the perception that investing in the public, investing in infrastructure, in public service provision might not even be necessary. So this, the distribution of the coping mechanisms, and what are your thoughts on these two political economy scenarios, and what do we do about it? Hector.
Very quickly, Claudia. I believe Raymundo made a very provocative statement. We can go to an strange equilibrium in the sense that the government is not reacting in a good way. The government, the state is not providing all these services. Okay, let's go to a smaller tax base and let us organize by ourselves and try to give privately or in a mixture of social and private, both extra state, all these services. That's a risk that, by the way, may work quite well for some segments of the populations, but the risk is that the poorest segments of the population and the poorest regions of the country may lag quite behind.
Even though I'm not an expert in Mexico, I think I just thought I might note that it's important to think about social innovation in the context of solving complex social problems, and how we do it need not only, and of course, I think for most people in the audience will recognize it may not even be led by the public sector per se. But as we think about social innovation, we view, kind of the Price Center, there's lots of definitions, but we imagine it as an iterative, inclusive process that leads to more effective and just outcomes to solve complex social problems. I think it's really important to think about the inclusive piece of social innovation and how you are going to include people to co-produce new ideas and solutions and so forth. I don't think for many of the problems that we've discussed that this can happen absent the public sector, but it need not happen only in the public sector. And so I think that's part of how we need to reframe our thinking. We can't, I should say, we can't just say, okay, we need to have like all sectors involved. That's too much of a panacea. It's too innocuous. It just is empty in many ways. It's true, but it isn't telling us the how. And so I think for social innovation to really work, we have to think really critically about what are the iterative approaches that are inclusive to address these complex social problems. And that will actually include all sectors, but it'll do it in a very specific way. And I think that's where we need to go. And I think given what I've learned already today from my distinguished colleagues, I think that's part of the solution in Mexico as well as in the US.
We have now a very interesting, more political economy question from the audience that I want to share with you. There is this political phenomenon studied in the comparative political science literature on populism and executive leadership, about the incentives and the consequences and the implications of pandemic denialism. So given this has been attributed to Bolsonaro, Duterte, López Obrador, or Orban, and even Trump. Graciela started with this very, worrisome data on the effects on income, mental health, and then shared with us how the government had no specific, direct, tailor-made response to this type of shock and its differential impact across groups of the population, areas of the country, and also their long-term implications. So I would like to bring this question to you. Was there a role in pandemic denialism affecting this outcome? Is there a responsibility? Is there a role for social science research to enter the debate, visibilizing the nature of the impacts and the necessity of public response? What are your thoughts on this, the evident trend, I would say, of public officials having the incentive to minimize the extent of the risk and of the cost, and therefore adopting policies that are going to be more costly in the long term? How do you see this in the Mexican case playing out? And of course, Gary and Emma, if they want to comment on the US or any other cases, are of course welcome.
Well, in the case of Mexico, Claudia, there was a clear fiscal denialism, and we need to question ourselves to what extent our institutions are able to respond. Even though the Mexican Congress wanted to tailor a specific package, the executive blocked it. So yeah, we need to ask ourselves that.
No one else would like to comment? What type of policies should we have seen, given what we now learn from the impacts of COVID?
What I would like to see, maybe not a specific policy, but maybe what Gary was saying, an inclusiveness of different participants to reach a decision on which policy might be the best. Only that. A willingness to talk to different people from the whole political spectrum. I think the risk we have now in Mexico is that people from different political parties close themselves and not discuss relevant issues with society and with other people in the political spectrum. So rather than thinking in specific policies, I really want to see politics to be back, to discuss these problems and to include all views. For me, that would be the most important part.
I would like to add, I think one of the biggest problems as well is that the government really uses other kinds of data, right? I mean, there's a clear diagnosis of what was going on in Mexico since early last year, and there's been not only production of data by the National Bureau of Statistics, but by other groups such as the one we're collecting, but they're actually ignored, right? So we need the first thing I would say that would be needed is by this type of government to recognize what the problems are, the magnitude of the problems, those that are losing the most, and then try to design policies to help them. But the first thing is that the problems have to be recognized. They're completely ignored. So I would start with that.
I think that links to the question about pandemic denialism. And I think we're seeing that throughout the world is how is evidence consumed and or appropriated And I think it speaks to those of us who are in the field of public policy that we ought to learn more from our colleagues in other disciplines like psychology, social psychology, et cetera, because it's absolutely essential, even if we're producing the evidence, as you were saying, Graciela, if it's ignored or it's countered with false informations or narratives, it actually puts us in a really difficult place. I appreciate also Raymundo's kind of hopefulness about what it might mean to be more inclusive with the ideas and dialogue. And I think what we need is the structures so that can happen. Those are just some initial thoughts, but I will cede to my colleagues on the panel.
Yeah, I agree with Gary. I think, particularly for low-income population in the U.S., we need more evidence, right? We see there are really structural problems in terms of poverty and inequality that we need to tackle them, and there has been effort, but we need to do more, right? And we need to understand better. As I mentioned, the work histories. We need to make sure, people are moving out of poverty, and there are options, right, for to move and social mobility for some groups that probably haven't had that, and the U.S. is historically been fantastic about this, so we really need to put more effort. And what Gary was mentioning about other type of government programs, the government intervention during COVID-19 has been very successful in many ways, but then how are we going to continue using these type of programs for the future, right? Like, is this a temporary intervention from the government, or how are we going to use this experience to alleviate poverty and reduce inequality?
I just want to emphasize what Emma said. The evidence suggests that with the policies that were very much unconditional cash transfers, that child poverty and poverty overall were cut tremendously. And so I think that is, as she said, we need to come together to think about, in the US and or Mexico, the social safety nets are not robust. And so not making them robust has consequences, and we really need to face those directly.
I think, can I just say something about the joint agenda? I think it's a difficult time for Mexican researchers and Mexican universities, because there's, as I said before, this sector has been hit very hard, and it will continue to do so if my predictions are correct. And so coming together with researchers from the US to establish agendas and to look for external funding to fund our research is going to be crucial. I think that financing in Mexico, and especially financing studies and data collection and analysis, experiments, is going to be very difficult in the future, especially because this government is not really willing to put its bet there. So I would say that workshops like the one we're conducting right now is very important. Mexicans will definitely need a lot of support from the US to continue conducting research. Otherwise, I don't know if part of it is going to die. I'm really worried.
Thank you, Graciela. You know me, I'm always try to be the optimist, and I think that spaces like this one are a very good starting point to share both our common strengths in terms of rigorous empirical research addressing pressing issues, identifying common challenges that have also political economy and cross-border implications. And from the very, very rich discussion that we have today, I can identify a set of issues that are going to be of strategic relevance, both for research, for policy, and even for democracy. Because as it was pointed out, in Mexico, and not only in Mexico, this is a difficult time for evidence-informed policy. This is a difficult time for political solidarity and pluralist dialogue. And this is also a difficult time in the sense that we still lack the basic evidence to fully understand what has been happening as a result of COVID and how this shock will unleash over time and affect life cycles in a world that is more globalized than ever, both for economic and political reasons, but also with the risk of that climate change entails. And the first step, in my view, in going in this direction is trying to focus as researchers and as policy experts. I was struck by when I arrived at USC at the motto of the school. The Price School is in the business of forging solutions toward a resilient and just world. And forging solutions toward a resilient and just world implies, from the perspective of applied social science research, being more collaborative, open, and understanding the many directions that learning can have and all the synergies that can be created and constructed with collaboration, exchange, dialogue. I am honestly very grateful for USC for hosting the Mexico Studies Chair, because it is a step in this direction. And in the process of dialogue and communication, there are so many opportunities both for research, collaboration, and of learning that can be done, on a piece-by-piece basis, or but with higher ambition. So the point of this seminar was starting with this informal conversation in which we share our experience and our perspectives. Also thinking that there is a world out there for international cooperation, for collaboration, and that as academics we do have a duty to try to inform policy to the best of our possibilities, try to aid in visibilizing and creating awareness of pressing social issues, specifically the ones that are faced by low-income communities and people who are usually not visible in politics and standard political economy discussions, and also understand the opportunities for lessons on both ways. Mexico, despite the case of the very unfortunate, irresponsible, I would say, elimination of Prospera, has some experience on emergency safety nets and conditional cash transfers that can be relevant for American debates. The well-known study of aid, the politics of aging, the politics of social exclusion, and the economics of economic vulnerability that is also well studied in the US, and that USC has many strengths in this respect, is also an important opportunity for Mexican institutions and scholars and specialists on Mexico and Latin America more general, because some of these issues, such as the increasing urbanization of poverty, the logics of social exclusion among metropolitan areas, and how that interplays with an aging population and the need of a freer flow of human capital, are all issues that are usually addressed from a perspective of the national policy space, despite the fact that they are closely interconnected. No, human capital accumulation, migration, the effects of the US-Mexican complementarity, both in economic terms and social connections. So this is just a beginning. I just will say that we have discussed the need to have new and better evidence regarding the impacts of COVID and its long-term implications. We need to have a good sense of the political economy constraint that this implies, so that evidence can inform policy that is politically doable and feasible, and in the process be very aware of the long-term and resiliency implications that these choices may have. When we work in the field of public policy, the interplay between the transformative power of scientific knowledge and the transformative power of policy and democratic dialogue, we are aiming for the connection between these two. And given a time of crisis and a difficult time for academia in Mexico and scientific knowledge in general, I think building spaces like this is both a symbolic and a substantive step in this direction. And for this reason, I want to thank you for your participation, for your time. Thank you, USC, for being so proactive in pursuing these linkages and is interested in shared collaboration. And Gary, I don't know if you would like to comment, give final comments. This has been a very enriching conversation, and we strongly appreciate it.
Thank you, Claudia, for really taking the lead on this work. We don't often have the opportunity to learn from each other in clear ways. We face common challenges, but also different ones. And I think, programs like Progressa, for instance, have informed, a movement in the U.S. around unconditional cash transfers, and in that way, I hope we can continue to learn from each other, and I look forward to the future. So I also share with you, Claudia, the optimism despite somewhat dark times. I think we have to be realistic, but I think together we can help solve some of the real problems in our region. With that, let me thank also the audience for joining us today. And you will be able to please reach out to me or Claudia, Emma, Graciela, Raymundo, Hector, Angela down in our USC Mexico office. We're happy to follow up with you if you have other questions, and we look forward to engaging with you in the future. Thank you.